ओके, लेट्स बी रियल। रात को 2 बजे तक एंडलेस स्क्रोलिंग, इंस्टाग्राम पर ट्रेंडिंग स्किन केयर हैक्स को सेव करना, रैंडम रील्स देखकर रैंडम प्रोडक्ट्स को ऑर्डर करना, और फिर जब एक्ने और पिगमेंटेशन जैसे स्किन इश्यूज स्टार्ट होते हैं तो 10 गुना टेंशन लेना। काफ़ी रिलेटेबल है ना? इसका कारण सिर्फ पोल्यूशन और स्ट्रेस नहीं होता, बल्कि हार्मोनल इम्बैलेंस, लाइफस्टाइल हैबिट्स और बहुत बार सेक्सुअल हेल्थ भी होती है। ये सब चीज़ें कहीं ना कहीं डायरेक्टली या इनडायरेक्टली आपकी स्किन को अफेक्ट करता है, और बाय द टाइम आप इसको रियलाइज़ करते हो बहुत देर हो जाती है। इन्हीं सब चीज़ों को अवेयर कराने के लिए हम स्वागत करते हैं डॉक्टर साक्षी पाटीदार, एमडी इन डर्मेटोलॉजी, वेनेरोलॉजी एंड लेप्रेसी। सो वेलकम डॉक्टर साक्षी।
Thank
Hi.
you.
So first tell me a little about yourself.
So, I'm Dr. Sakshi Patidar, and I have done my MD recently from BJ Medical College, Ahmedabad. And currently, I'm looking for my bond posting because we have a 1 year bond posting, government bond posting, since I've done it from the government college.
Okay.
So, I'm waiting for that posting.
Okay, so after you finish that only then can you start your own practice, or
Yeah, because
it's
that
a
is
mandatory
mandatory,
thing?
yes, in the peripheral CHCs or district hospitals.
ओके, सो एक बहुत कॉमन क्वेश्चन जो सबके दिमाग में आता है, ठीक है, कंसिडरिंग द करंट ट्रेंड्स, कि व्हाट इज डर्मेटोलॉजी एंड व्हाट इज कॉस्मेटोलॉजी,
Yeah.
व्हाट इज द डिफरेंस बिटवीन द टू?
So cosmetology is basically it's just a process like anyone can do the cosmetology. Okay, every board you can see, every parlor board you can see that we are the cosmetologists.
Correct.
So that is not science. Anyone can do the cosmetology course and they can be certified because India में cosmetology के लिए कोई degree नहीं है.
Okay.
And dermatology, it's a science. It's basically the study. First, to have be called as a dermat, first you have to do MBBS. That is a 5 year course. Then 3 साल का MD होता है. Then only you can call yourself as dermat.
Okay.
So not every cosmet clinic is bad. Many doctors also write that they are cosmetologists, so that is okay. But any person who has not done anything with the medical field and they are claiming themselves as a cosmet, and then you go to them, then you are risking yourself.
Correct.
So whenever you are going to a place where they claim that they are cosmetologists, so first you have to see that whether they are the trained medical practitioners or not. So that's the major difference, that dermat is science and cosmet is just a skill.
Okay, so anyone can acquire that skill, right? You don't need to have a medical background to get into cosmetology.
Yeah, because for cosmet India में ऐसे कोई rules अभी तक बनाए नहीं है. It's just कि कोई 5 दिन का कोर्स कर लेता है, कोई 10 दिन का कोर्स कर लेता है, and they claim themselves as a cosmetologist.
Okay.
But they don't know anything about skin. They are just doing the procedures, the peels, the lasers, the facials, and they are claiming that they are cosmets.
So dermatology, as you said, कि वो science backed है, right?
Yes.
So what comes into the dermatology scope?
So dermatology includes all your skin problems, all the systemic conditions that are causing the skin problems, that also comes in it. Not just acne, it includes acne. So when we have the exam, we don't just have dermatology, we have dermatology, venereology and leprosy.
Okay.
So venereology is your STDs, that's the sexually transmitted diseases, and the leprosy as well. So all these three things, and apart from acne there is psoriasis, then there is pemphigus, then there is systemic lupus erythematosus. Every skin diseases also, when they come on your skin, that also comes under dermatology.
Okay.
So it's not just the acne and the beautification thing, it's a lot above that.
So आजकल हम लोग ट्रेंड्स में देखते हैं, ठीक है, एवरी अदर इन्फ्लुएंसर और अ कंटेंट क्रिएटर, दे कीप प्रमोटिंग रैंडम प्रोडक्ट्स, राइट? बहुत बार बोलते हैं कि लाइक यू नो हेयर में भी मिनॉक्सिडिल होना चाहिए, इसमें आपका सिरेमाइड्स और वो सब, लाइक यू नो देयर आर लॉट मेनी साइंटिफिक टर्मिनोलॉजीज जो इंटरनेट पे आते रहती हैं. So what is your take on that? How true is that?
So one thing, this ad thing, it's like many patients come like कि हमने ये वाला देखा था, इतना सब वायरल हो रहा है. So वो प्रोडक्ट वायरल हो सकता है, but your skin is your individual.
Correct.
Also, their ad is universal, but your skin is individual. What works for you might not work for me, because my skin is different, your skin is different. अभी वो लोग ऐड करेंगे तो वो इतना मार्केटिंग गिमिक करेंगे कि आपको फोर्स कर देंगे कि आप खरीदो. बट यू शुड अंडरस्टैंड दैट इट्स योर स्किन एंड इट्स नॉट एन एक्सपेरिमेंटल लैब दैट यू कैन एक्सपेरिमेंट. अभी वो लोग दिखाएंगे दैट कोरियन ग्लास स्किन.
करेक्ट.
सो फॉर कोरियन ग्लास स्किन यू हैव टू हैव कोरियन पेरेंट्स. That's the only thing.
Genetics work.
Exactly.
Yeah.
That is Korean glass skin because that's in Korea. You can't have that Korean glass skin in India because
Weather
we have
conditions और वो सब भी बहुत
exactly
matter करता है.
ethnicity and genetics are very 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 important factors in that. But वो लोग lights लगा के रिंग लाइट लगा करके वो आपको filters लगा कर दिखा रहे हैं. You don't know that they are using that product daily or not. But they will influence you. That's why they are influencers.
Right.
So you should understand that you should buy that products or not. So what you can do is at least read the ingredient list on the back. So for example, they are saying that it has hyaluronic acid. But whenever there is the ingredient list, so it has a rule that whenever जब भी आप लिख रहे हो तो जो ज़्यादा क्वांटिटी में प्रोडक्ट है दैट यू हैव टू राइट ऊपर.
Correct.
तो आप इंग्रेडिएंट लिस्ट पढ़ो, पता चला कि वो हाइलुरोनिक एसिड सबसे लास्ट में लिखा है. So they have just put a drop of it. So it will not work. Secondly, you have to see that whether it will work for your skin or not. Because acne prone skin के अलग products होंगे, dry skin के अलग होंगे, combination के अलग होंगे. उसने आपको दिखाया है, that person will force you to buy that thing. ऐसे नहीं कि हर इन्फ्लुएंसर की स्किन ही वो फिल्टर वाली होती होगी उनकी अच्छी. बट उन्होंने जो प्रोडक्ट तुम्हें दिखाया है वो यूज कर रहे हैं या नहीं, वी डोंट नो.
That we don't know.
Then they have that 7-step skincare routine and they will add retinol in that, vitamin C in that, sunscreen in that, AHA, BHA, all these actives, they just damage your skin barrier.
So not necessarily कि वो आप पे काम करे, right?
Exactly.
It might work for me, it might not work for you.
As I said, the ads are universal, but your skin is your individual. Okay. You should always see your skin, what works for your skin, and then only use it.
So is it not wrong for these manufacturers or brands to promote it on a general basis? Is it not wrong?
It is wrong, but there is no such laws against that because then they said that we have tested it.
Right.
We have not forced you to buy it, but it's always an individual choice.
Right.
Even I as a teenage get very this
We get
ki no
influenced
मुझे
like,
ये
you know,
लेना है,
ऐसा
yes,
चाहिए.
because इसकी कितनी अच्छी skin है, तो that is very normal.
Right.
But nowadays इतना awareness है तो थोड़ा awareness skin के लिए भी, because skin is the largest organ of our body.
Correct.
So anything wrong happens on your skin वो visibly दिखता है.
And that is, I think, आज के ट्रेंड, लाइक आज के लाइफस्टाइल में स्किन और ओवरऑल लुक्स काफ़ी ज़्यादा इन्फ्लुएंस करते हैं अपने हमारे कॉन्फिडेंस पे,
Yes,
राइट?
true.
सो दैट इज़ व्हाई पीपल इन जनरल आर वेरी nitpicky about it.
Yes.
कि भाई मेरा स्किन तो ऐसा flawless होना
But then
चाहिए.
they are also influenced by these influencers
Correct.
also to buy the things also.
Correct.
Because वो लोग इतना अच्छे से उसको मार्केट करते हैं कि फिर वो ऐसे हो जाता है कि नहीं एक बार ट्राई करके देखते हैं, और वो एक बार ट्राई करने के चक्कर में स्किन खराब हो जाती है.
Actually, there was this case, Instagram पे आया था कि a girl used a Korean product.
Okay.
Basically कि एक मास्क था उन्होंने पहना and then she faced a very severe breakout of acne.
Yeah.
Right? So it ruined उसको spots भी काफ़ी ज़्यादा आ गए. So जब हम लोग ये pimples और ये सब की बात करते हैं, what is your definition of a perfect skin? It might not be perfect, but like you know एक average के हिसाब से skin कैसे होना चाहिए? Because little open pores, थोड़े
Yes.
blackheads वो सब normal होते हैं.
So अभी there is this thing कि fair skin is the healthy skin.
Correct.
So there is no relation of skin, healthy skin, with the color of the skin. Every skin, healthy skin also has pores. It has texture. It can't be that glass skin कि वो एकदम light reflect करे. So healthy skin has to be like your skin, whatever color you have, that has no role कि आपका skin healthy है या नहीं है. अभी एक्ने भी है तो इसका मतलब ये नहीं कि आपका स्किन अनहेल्दी है. येस, अगर आपके डाइट में बहुत ज़्यादा जंक वगैरह है सो दैट डेफिनेटली योर लाइफ स्टाइल इज़ अनहेल्दी, बट दैट कैन बी वर्कड अपॉन. इफ़ यू आर वर्किंग आउट, इफ़ यू आर ईटिंग गुड, देन automatically it shows up on your skin.
Right.
So if your skin is like not having any rashes or any blisters, or it's not reacting to the sun, but some people are sensitive to sun.
Right.
So as such, there is no definition of a perfect skin, but you should definitely protect your skin barrier to keep it healthy.
So sunscreens basically
Yes.
play a very critical role in this. How would you like India के लिए sunscreen ज़रूरी है? How important
Definitely.
is it?
So sunscreen is important because it protects you from the UV. Okay, so there are two kind of UV rays. One is UVA and one is UVB. तो कुछ लोग बोलते हैं कि अरे हम तो अंदर रहते हैं, हम क्यों सनस्क्रीन लगाएं. So जो UVA है, that is the main role for the aging, skin aging. So that penetrates the glass as well. Okay. So even if you're working indoors or if you're near the window, you should use sunscreen because that will prevent the aging in you. And the UVB is mainly for the skin cancers and everything. So definitely it is important that you should use it to protect yourself in future. Not that it will give you fairness or anything, but it's just a protecting factor for your skin.
Just keeps your skin healthy overall,
Yes.
right? Okay. And as the technology is advancing, right, how important or how crucial do you think AI or technology will be in dermatology?
AI not will, AI is in dermatology. There's a skin cancer which is called melanoma. So there are many studies which showed that the AI driven devices had actually diagnosed melanoma better than the dermats.
Okay.
They had like more sensitivity in diagnosing that thing than the dermats. So future AI would be important for the dermats, and nowadays there is a system called ARTAS for the hair transplant. So the robot is extracting the hair and robot is transplanting the hair, but definitely it is done under dermat supervision. So in future AI would be there, and dermat plus AI, that would give the better outcome.
Right. So basically, it will enhance the accuracy, precision, and
Definitely.
the turnaround times for
Yes,
it,
definitely.
right? So whenever we have a breakout, like pimples हो जाते हैं या skin rash हो जाते हैं, as you mentioned, के STDs also play a very major role in like these kind of problems. So how do you differentiate the three?
Acne and
Like basically any kind of skin problem, skin rash हो गया या
okay,
STD के थ्रू अगर कोई infection हो रहा है,
okay.
so how do you differentiate that?
So differentiating this would definitely need a medical supervision,
Intervention,
yeah.
correct.
Because फिर वो लोग घर पे diagnosis is very risky. So on the basis of just assuming that I can be having STD or I can be having a skin allergy, that is very difficult to like assume it on your house or anything. Anything you're having on your genitals, anywhere, you should definitely go to your dermat.
Okay.
Not to a pharmacist, because इंडिया में हर कोई डॉक्टर है, घर में डॉक्टर है, सब
Everyone is a
बोलेंगे ये
doctor.
कर लो वो कर लो, और सबसे पहले डॉक्टर के पास जाने के पहले वो फार्मासिस्ट के पास जाएंगे,
जाते हैं.
और फार्मासिस्ट जाके आपको स्टेरॉइड क्रीम देगा,
Right.
और वो स्टीरॉइड्स आप वहाँ पर लगा करके उसको और डैमेज कर दोगे.
Right.
सो
Because घरेलू नुस्खे भी बहुत सारे होते हैं.
बहुत
Like कुछ
सारे,
भी हुआ तो एलोवेरा डाल दिया. Like you
या
don't know if
हल्दी
that
लगा
will.
लो, टूथपेस्ट लगा लो. So everything is not meant to be used on your
So
skin.
in general, this falls under leprosy, right? So how real is leprosy in India?
Leprosy in India is a very big problem, and for now the prevalence has decreased a lot in the past 30-50 years, but it is still a problem because children are also getting it. So when children gets leprosy, उसका मतलब है कि वो active transmission है. और अभी भी like हम लोग जब रेसिडेंसी कर रहे थे तब ऑलमोस्ट रोज के 3-4 लेप्रेसी के पेशेंट्स आते थे और न्यू आते थे. बट लोगों को क्या है कि लेप्रेसी है तो वो स्टिग्मा बहुत है. सो पीपल आर नॉट दैट अवेयर दैट हमें ये सब हो रहा है तो हम जाएं.
Right.
और प्राइवेट प्रैक्टिशनर्स के पास तो बहुत कम केसेस आते हैं लाइक, बट गवर्नमेंट के पास काफ़ी ज़्यादा केसेस आ रहे हैं. एंड ऑल्सो पीपल थिंक कि अरे इसको लेप्रेसी हो गया तो हम इसको छुएंगे नहीं. तो इट्स नॉट दैट कि जस्ट बाय पासिंग अराउंड अ लेप्रेसी पेशेंट आपको लेप्रेसी हो जाएगा. वो ईयर्स ऑफ क्लोज कॉन्टैक्ट और इनहेलेशन, इट इज़ बेसिकली अ बैक्टीरियल डिसीज.
Okay.
बट उसका इंक्यूबेशन पीरियड बहुत लॉन्ग है, लाइक 9 to 10 ईयर्स है. तो और वो जो लोगों को ऐसे भी है कि अरे इसकी उंगलियां नहीं है तो इसको लेप्रेसी है, बट वो ओवर द टाइम नर्व डैमेज की वजह से होता है.
Okay.
एंड इट्स नॉट दैट लेप्रेसी इज़ नॉट क्योरेबल, इट इज़ क्योरेबल. एंड जो दवाई आती है उसकी MDT वो गवर्नमेंट फ्री में देती है,
Okay.
बट द अवेयरनेस इज स्टिल लैकिंग.
Lacking, yeah.
So that is very important because once you get the treatment, it is curable, it is preventable. So even like if someone in your house is having leprosy, right? So जो भी close contact है उनके लिए भी prophylaxis है, single dose rifampicin गवर्नमेंट देती है. सो अगर आप वो भी ले रहे हो तो आप 60-70% उससे प्रोटेक्टेड हो.
Right.
तो वो सब अवेयरनेस थोड़ा लैकिंग है, बट डेफिनेटली द प्रेवलेंस हैज़ डिक्रीज्ड इन द प्रीवियस 30-50 years, बट इट्स स्टिल देयर बिकॉज बच्चों को भी लेप्रेसी अभी हो रहा है. सो व्हेन children gets leprosy, it means that active transmission is there.
Right. So is it more के hygiene से related होता है ये
No,
चीज़?
not at all. It is a bacterial disease. There is no
Okay.
connection with hygiene. We have seen people from well-to-do family also having leprosy.
Okay.
So it's just a bacterial disease and it's just a matter of transmission and nothing related to hygiene.
So just for my knowledge, is herpes also a part of that?
No, herpes is a sexually transmitted disease.
Okay.
It's a
So
different.
it's entirely a different
Yes.
thing. Okay. So in the future, okay, there are a lot many aspiring dermatologists, like
Yes.
colleges mein hai abhi, they are looking into getting into this profession. So as an experienced doctor, what would be your suggestions or something that you would like to tell them
Okay.
basically?
So residency is the most important phase. जो भी सीखना है just learn it in your residency because that is your base.
Right.
जितने पेशेंट्स देखने हैं, जितनी गलतियाँ करनी है, गलतियाँ करके सीखना है, वो रेसिडेंसी में सीख लो. And in future, clinical judgment plus technology driven would give the best outcome.
Right.
Because everything is tech driven these days and you have to be tech driven to get
You
the
have to
best
adapt to
outcome.
it.
So clinical judgment plus technology friendly, that would be give the best outcome.
Because by the sound of it, it looks like you've learned a lot in your residency. So any
Yeah.
particular cases or instances you would like to share?
There were many cases, but there was this patient, he was like 40-year-old and he was having Pemphigus vulgaris. So Pemphigus vulgaris is you get blisters all over your body. So जब भी वो blister they get eroded, all of your skin gets peeled. So he was like having 70% of his skin like पूरा
Okay.
peel हो गया था. But we did save the patient because he was like almost in the ICU for like 21 days. But he was saved. So that was one case which I'll remember.
Is it like, I know the word is very heavy, but do these kind of cases, traumatize you?
More than traumatizing, it was like our work. So over the couple of days, it does not like traumatize us, but we were like, we have to treat them, we have to do the dressings, and we have to give the medicines. So it does not, for initially
Bother you
it does,
much then?
but not over the couple of days.
Then why choose dermatology? Like, why this profession?
So when I wanted to do dermatology, I did not know that it will have emergency cases also.
Right.
So I wanted a work-life balance. So that was the main reason I chose it. But when I went into the residency, we do had like the emergency cases. We did indoor the patient also. It's not like just the 9 to 5 job in residency, of course,
Right.
because we have hospitals. So there are patients who come in the critical state. So we have to do the inpatient management as well. So but then in residency it teaches everything.
So ऐसा भी नहीं है कि भाई सिर्फ महंगे प्रोडक्ट्स को लेके अच्छी अच्छी इसमें काम करना है,
ये तो
वैसा जरूरी
बिल्कुल
नहीं
ही
है.
मिथ है कि भाई
Right.
डर्मैट इज इक्वल्स टू सनस्क्रीन एंड एक्ने.
Right.
Because it is beyond that, you get to see a lot of systemic lupus erythematosus and patients, all these patients come in like उनका 90% of the skin निकल चुका होता है, वो लोग
Right.
तब आते हैं. And then you have to like manage the patient in ICU and everything. And night में भी patients आते हैं emergencies में, like if they have urticaria, or there are many patients who got indoor in the midnight. So it's not at all like 9 to 5 in residency at least. After that it's your choice what kind of patients you want to manage.
आपके लाइफ में कभी ऐसा हुआ है कि जब आपका दिन, बोलते ना डॉक्टर्स यूजुअली हैव टू वर्क मल्टीपल शिफ्ट्स, लाइक डे नाइट, सो आपके लिए लॉन्गेस्ट डे कौन सा था?
Longest day, first year में we used to go in like 9 in the morning and I came 12 in the night. तो तब तो मुझे ऐसे था कि मुझे ये किसी ने नहीं बताया है कि डर्मैट ऐसा होता है.
राइट.
बट देन कंपेयर टू अदर डिपार्टमेंट्स, ऑफकोर्स हमारे डिपार्टमेंट में बहुत कम काम होता था बिकॉज उन लोगों का तो 36 आवर्स का शिफ्ट होता था. बट डर्मैट जो लोगों को 9 to 5 लगता है वो रेसिडेंस में 9 to 5 तो नहीं होता है, वो 9 to 9, 9 to 12 हो जाता है.
So if you would go back, let's say around 10 years, 15 years, what would you tell your younger self?
आई वुड जस्ट से कि पढ़ ले अच्छे से so that you get a good college.
Any personal myth that you once believed and after acquiring knowledge or experience के बाद now you feel के मैं क्या सोचती थी पहले, वैसा टाइप का कुछ इंस्टेंस?
यही दिस ब्रांड्स एंड ऑल कि टीवी में जो दिखा रहे हैं उनके बाल इतने अच्छे हैं तो वो लगाने से अच्छे हो जाएंगे, उन लोगों ने ये प्रोडक्ट लगाया है तो अच्छा हो जाएगा. बट at the time I was like really like 10-12 years, but then I realized कि not everything works for everyone.
Right.
That ad they are showing it's universal because they want to sell their product, but your skin is not an experiment. So that is one thing.
So like सबके jobs बहुत different होते हैं, like everyone comes from very different backgrounds, they work in very different environments. So अगर मुझे उसको एक baseline करना हो कि एटलीस्ट बेसिक इतना तो डे टू डे में करना चाहिए जिससे आपकी स्किन हेल्थ प्रॉपर रहेगी.
So basic mild cleanser. So today is the world that less is more.
Yeah.
That 7-step skincare products or स्क्रबिंग कर रहे हैं, हार्श सोप्स यूज़ कर रहे हैं, और people like use these nose strips की blackheads हटा दे, they are just damaging your skin barrier.
Right.
Because skin barrier is very important. You have this barrier to protect yourself from like pollution, any infections, and to prevent the water loss. But वो continuously harsh products use कर करके all these मार्केट से कुछ भी लेकर के आके you're just damaging your barrier. उसके बाद जो रेडनेस होगा, जो फ्लेकिंग होगा, वो फिर किसी भी सीरम लगाने से प्रिवेंट नहीं होगा. सो जस्ट अ माइल्ड क्लेंजर दैट सूट्स योर स्किन अकॉर्डिंग टू योर स्किन टाइप. Then moisturizer with ceramides, because ceramides is in our skin, so it's important. And then sunscreen.
Okay.
That's it. You don't need any serum on a daily basis. Even if you want to introduce any actives like, salicylic acid or retinol, so you should start it slowly, like
Right.
once in 3 days a week, or not daily. So, or even if you're using, for example, this retinol is viral these days.
Yeah.
So लोग literally इतने सारे 50 dots लगा लेंगे फेस पर. That is going to cause you a much redness and dryness, because retinol causes dryness on your skin.
Okay.
तो वो लोग लगा के दिखाते हैं and then people use it that way. Only a pea size amount retinol is enough.
Right.
And for retinol, it is a thing that less is more. So you should not use retinol like this, and you should not use it daily. Like 3 to 4 times a week is enough.
Overdoing it usually
Overdoing
causes more
anything,
damage.
overdoing anything causes the damage.
Right. So बहुत सारे अगर हम लोग मेडिकल के दूसरे डिपार्टमेंट्स में देखते हैं ना, तो देयर आर यूजुअली फिजिकल टेस्ट्स, राइट, कि टू डिटर्मिन व्हाट काइंड ऑफ ट्रीटमेंट्स और प्रोसीजर्स नीड्स टू बी डन. सो स्किन के लिए भी ऐसा कुछ है कि जहाँ पे हम लोग को पता चले कि व्हाट एग्जैक्टली डज माई स्किन नीड?
Not per se for the skin. If your skin is normal, then for that there is nothing test as much. But if you are having like black neck, or and you have, if your BMI is high, then definitely you can get the tests done for your hormonal imbalance.
Right.
But otherwise, if your skin looks normal, then for the skin perspective there is no such test. But for your overall health, you can definitely get them tested. Because anything on skin, any rash, it can be because of your liver etiology also. Your kidney can be problematic, but that all rashes are different. But if there is some rash that seems abnormal to you, then you can get your basic tests done.
Okay. So usually dermatology जब हम लोग बात करते हैं, some people know it is about the skin, some have no idea, okay?
Yeah.
But it is also about your hair. That is also one topic जो आजकल बहुत ज़्यादा लोग उस पर they get insecure, उस पर ज़्यादा
Yes.
ट्रीट करते हैं. तो हेयर का कितना डर्मेटोलॉजी में स्कोप है, like for future candidates basically?
Okay. So about the hair.
Yeah.
So dermats can also do hair transplant.
Okay.
So that is one thing. They can get the fellowships done for that and do the hair transplant. Then there are the cosmet part, the Botox, the fillers. So it's really important, because when we are studying skin, we are studying the skin anatomy as well. We know where this nerve is, where the artery is. But when you go to a cosmet, he is not knowing anything about the skin anatomy. तो what if उसने फिलर डाला, आपकी आर्टरी में चले गया,
Right.
सो आपका स्किन तो गया, वो निक्रॉस हो जाएगा पूरा. सो तब आप किसके पास जाओगे? बिकॉज वो लोग अकाउंटेबिलिटी नहीं लेंगे. फॉर दैट बोटॉक्स भी है. सो बोटॉक्स इज बेसिकली अ बोtulinum टॉक्सिन.
Okay.
सो इट्स अ टॉक्सिन दैट पैरालाइजेस योर मसल. तो जो मसल ओवर कॉन्ट्रैक्टेड होती है, उसकी वजह से रिंकल्स आते हैं.
करेक्ट. तो एक्सपांड होके फिर वो,
हाँ, तो वो पैरालिस कर रहा है उस मसल को. अभी अगर उसने नर्व में लगा दिया, तो देयर आर मेनी केसेस कि कभी कभी ये आई टोसिस हो जाता है. व्हेन यू गेट द बोटॉक्स डन, वो टोसिस हो गया. बट फिर वो, ऑल्दो इट गेट्स रिवर्स्ड, बट फिर वो 5-6 मंथ्स तक आपको आपकी आईज ऐसे लेकर घूमना पड़ेगा.
करेक्ट.
सो वो लोग अकाउंटेबिलिटी नहीं लेते. सो नेवर एवर like go to them, because they have no knowledge about the skin anatomy.
I think this is very important for the audience also to know the difference between the two. So I'm very glad that we covered this in this, because I've seen a lot many people, even like हमारे vicinity में we are well connected, so people around us also do the same mistake. They are like, मैं तो कल ही cosmetologist के पास जाके I'm getting this done, I'm getting that done, but then if anything goes wrong, they are just stranded over there कि अब
Yeah.
मैं क्या करूँ, अब मैं
Then they
किसके
go to
पास
the
जाऊँ?
dermat. They don't go
Then
to
they
the
go to
dermat
the
at the
dermat.
first place.
Correct.
When something wrong happens, then they go to the dermat. और ऐसा फोमो हो जाता है ना कि अच्छा तू करा के आया, तेरा तो अच्छा हो रहा है, मैं भी करा के आऊँगा.
Correct.
But they don't know कि your skin, my skin, everyone's skin is different.
It's different.
Everything has an individual skin and it reacts differently.
Do you enjoy the field that you're in?
Yes, definitely.
Was it
Because
rewarding? Like
yeah,
you said that you were looking for a work-life balance, right?
dermat is something you get to do the surgery part also. You get to do the medicine part also. So it's a multiple thing in one branch kind of a thing.
Right.
Because you are seeing dermat patients, you're seeing the hair patients also, then the STD patients also, then the leprosy patients also, then you can do chemical peels, you can do laser also, you can do these days people can do cosmetic surgeries also, like the mini cosmetic surgeries, then you can do hair transplant also. So it's like a never ending branch.
So it's a large pool basically, a lot of
Yeah.
opportunities when
Yes.
you get into dermat. What are the other pros and cons again for your junior fellows basically?
The pros are definitely it's a like you will never get bored of this branch because you have a lot to do
Correct.
and you can manage your time. Like there is no kind of a emergency that you have to wake up at night कि नहीं मुझे patient देखने जाना पड़ेगा. Because mostly the patient private में तो patients acne, hair fall majority
उसी सब
pool
cases के
वही
बारे में
वाले
है,
होते हैं.
correct.
जो केसेस हमने डेफिनेटली मेडिकल कॉलेजेस में देखे उतना वेरिएबल केसेस हमें नहीं मिलते. डेफिनेटली दूसरे स्किन डिसीजेस के भी आते हैं. सो इट्स नॉट लाइक कि मुझे रात को उठ के जाना पड़ेगा. सो दैट इज़ वन वेरी big advantage of this branch, that you have a good work life balance. You can explore a lot of things. Every there is some new advancement, some new is coming, like exosomes, then any injectables is coming. So you have like lot to do in the future. And the cons is like lot of people are claiming themselves as cosmetologists. So you get मतलब at last उन्हें समझ आ ही जाता है that वो लोग नहीं अच्छे. बट देन वो थोड़ा सा इनिशियली बिकॉज पीपल गो टू देम फर्स्टली बिकॉज वो लोग पैसे भी कम लेते हैं. तो लोगों को पहले तो वही है कि वो कम पैसे में करके दे रहा है तो हम उसके पास ही जाएंगे. डॉक्टर के पास जाके कौन फीस लगाए और फिर प्रोसीजर का भी पैसा दे. यस, सो वो एक कौन हो सकता है. बट competition is in every field, so at last everything has its own cons and pros.
So as you pointed out very correctly कि cons तो हर चीज़ में होते हैं, right? But this one thing is very severe because it can damage your skin permanently, right? Again, moving back to the internet world, ठीक है, कि आए दिन वहाँ पे products वो लोग highlight करते रहते हैं, कुछ ना कुछ दिखाते रहते हैं. And the common pit that the consumer falls into is कि मैंने आज क्रीम लगाया, कल जाके मैं चेक करूँगा कि डिफरेंस आया है कि नहीं. सिमिलर टू जिम्स, हम लोग एक दिन जिम जाते हैं, दूसरे दिन ट्राइसेप्स और बॉडी चेक करने लगते हैं, राइट? सो आई नो, लाइक आई फॉर अ फैक्ट नो कि इट रिक्वायर्स अ लॉट ऑफ टाइम टू get this into, but as a professional, as a doctor, what is that one message you would like to give your audience?
So people are just focusing कि हम ये प्रोडक्ट लगाएंगे हमारी स्किन अच्छी हो जाएगी. योर स्किन इज़ नॉट जस्ट योर फेस, योर स्किन इज़ योर होल बॉडी. So it needs something from inside. So you have to eat good so that your skin is also good. Like आपने sunscreen लगा लिया, serum लगा लिया, so it's only penetrating this your face, right? You're not applying it on your whole body. So that does not makes any difference. Also the products you're using, abhi this collagen, it's so much in trend, like collagen creams, collagen sheet masks. Collagen is a big molecule. हमारी स्किन उसको पेनिट्रेट ही नहीं कर सकती है. आप जिस टाइम पे लगाओगे वो आपको एक प्लम्पी इफेक्ट देगा, बट इट इज़ नॉट गोइंग इनसाइड योर स्किन एंड डूइंग द कोलेजन रीमॉडलिंग. फॉर दैट आपको लेजर्स, माइक्रो निडलिंग, आप ये सब कराओगे तब आपका कोलेजन रीमॉडलिंग होगा. And when you're eating healthy, like you're having fruits, veggies and good protein in your diet, then your skin would be healthy. So diet plays a very important role. Diet and exercises, definitely the healthy lifestyle will give you the healthy skin. Not these 7 products will give you the healthy skin. Because skin is not just your face, it's all your body.
Right.
So diet plays a very important role.
Basically it is not just about the products.
Yeah.
आप क्या खा रहे हो, how much are you hydrating yourself?
True.
How much are you exercising? And upon that, जो products और जो हम लोग का जो daily routine बोलती है, that would amount to around like 20-30% of the overall routine. right? So it requires a lot of patience, if one
True.
would say. Immediate results तो expect हम लोग नहीं कर सकते इसमें, right?
Most of the skin conditions that we have, right, 70 to 80% I would say that is autoimmune.
Okay.
Now what is autoimmune? Autoimmune means आपके खुद की immunity is attacking yourself. So for that, all these are chronic conditions mostly. So for that, many conditions require steroids also. But वो steroids कब देना है, कितना देना है, कैसे देना है, that we know because we have studied it. But market में क्या है, everyone is going buying the steroids. For example, fungal infection है. अब उसके लिए कोई भी पहले डर्मेट के पास नहीं आएगा, फार्मासिस्ट को बोलेगा अरे हमको रिंग वर्म हो गया है तुम हमें क्रीम दे दो, तो वो स्टीरॉइड वाली क्रीम देंगे. अब उससे वो और बढ़ जाएगा. सो देन वो इट मेक्स इट मोर डिफिकल्ट टू ट्रीट. देन दे विल कम टू अस अप्लाइंग 5-6 थिंग्स ऑन देयर इन्फेक्शन एंड देन दे विल एक्सपेक्ट कि नहीं भाई हम 10 दिन से लगा रहे हैं ठीक नहीं हुआ है. इट विल टेक टाइम बिकॉज all these conditions need patience. Now certain conditions are autoimmune, so when you're stopping your own immunity to stop attacking on yourself, तो उसमें time लगेगा and it needs patience. But when you have patience, but then वो eventually ठीक होता है. But then फिर लोगों को ऐसा लगता है कि नहीं ये डॉक्टर अच्छा नहीं है तो वो डॉक्टर चेंज कर देते हैं. Then again the treatment goes on the square one. So you have to have patience whenever you're having any skin conditions. Just trust your one doctor and just follow whatever he or she is saying. Because skin conditions need patience. They takes time to get healed, but not to like over diagnose yourself and just self treat तो बिल्कुल नहीं करना है.
Because it is one of the organ that keeps repairing itself for
True.
a longer period of time, right? So ऐसा भी नहीं है कि कुछ भी damage हुआ है, while I'm just assuming, but most of the cases it is reversible. Like any kind of a damage done to your skin, it is reversible over time.
Over
Would
the
you say-
time, but many conditions are such like if it has caused the like most of the damage, then we have to do the skin grafting. But
Okay.
skin has its property of regenerating itself. It's like it has the turnover of 28 days.
Okay.
तो जो since you have said about the regeneration thing, लोगों को ऐसे है कि हम स्क्रब करेंगे तो हमारी डेड स्किन निकल जाएगी. आपकी स्किन खुद ही डेड स्किन को निकाल देती है 28 डेज
It's a
में.
process that your body
Yeah,
does.
but when you are scrubbing, आप अपना बैरियर हटा रहे हो.
Okay.
Because that barrier is meant to stay there. But when you are scrubbing, you're just इतने harsh way में उसको scrub कर रहे हो, आप अपनी skin के normal layer को निकाल रहे हो. So then more dust will go, more infection you will get, and more redness you will get. So that regeneration property is a beautiful thing of skin because it regenerates on its own.
Correct.
Any healing process, we get a cut, the skin gets repaired itself, right? Even if it's a big cut, the skin comes there.
Again.
So normal regeneration also skin does it in like 28-25 days. So you don't need to like do it on your own.
Overdo नहीं करना है वो
बिल्कुल
चीज़
नहीं.
को. So basic आप अपना healthy lifestyle रखो,
Yes.
खाना पीना अच्छे से करो, and just keep a normal जो आपने day care routine बताया कि like sunscreen is important, especially for our environment. So I think more or less that will do get the job done.
True.
Yeah. As we come near to the conclusion of this podcast, a few words for the audience.
Don't go for the marketing gimmicks that the influencers are selling. Just trust your skin, know the product before you're buying it. Just keep your skincare less because less is more. Use your sunscreen, don't forget it. And just your skin is your individual thing. The marketing gimmicks are universal because it's your skin and not your experiment. So stop experimenting your skin and just know your skin and stick to one skincare routine.
Thank you so much, Dr. Sakshi. This podcast was not just about skin treatments, it was more about the awareness to make sure that your skin receives the right kind of care that it needs and not just viral marketing gimmicks that we usually see. So we'll see you again on the next podcast with another healthifying conversation and another expert just on Doctors of India. Thank you.